Right now, if you need surgery, someone will put a mask over your face, count you down, and the next thing you know, you are waking up in a recovery room with no memory of what happened in between. That gap, the blank space where the surgery is supposed to be, feels normal to you. It has always been there. But for almost the entire story of the human species, that gap did not exist. People needed surgery for tens of thousands of years before anyone invented a way to turn off the pain. And somehow, some of them survived it. So how did that actually happen? How did a person with no modern medicine, no antibiotics, and no anesthesia get cut open and live to tell the story? We can answer that question, because the evidence is still here. It is buried in old skulls, written on ancient scrolls, and recorded by soldiers and surgeons who watched it happen with their own eyes. Let's go back and see it for ourselves. Picture a small village, roughly 7,000 years ago, somewhere in what is now France or Peru. A man in the village has been having violent seizures for months. His family believes something is trapped inside his skull, some kind of pressure or spirit that needs a way out. The healer of the village has one tool for this problem, a sharpened piece of stone, and the only way to use it is to press it against the man's skull while he is fully awake and slowly scrape a hole through the bone. There is no version of this where it does not hurt. The man is held down by 2 or 3 other members of the village, gripping his arms and his head to keep him from jerking away from the blade. The healer works slowly, because working too fast risks cutting into the brain itself, and that mistake is fatal. The scraping can take an hour or more, and the man is awake and fully aware for every minute of it, feeling the pressure and the grinding through his own skull. All he can do is endure it, one scrape at a time, until the healer finally breaks through the bone and stops. This procedure is called trepanation, and it is one of the oldest surgeries we know of. Ancient people carried it out with no idea why it sometimes worked, and no way to explain what was actually happening inside the skull. They only knew that some patients who had it done went on to live for years afterward. And we know that because of what was left behind. Archaeologists have uncovered more than 1,000 ancient skulls with these holes cut into them, found across Europe, North Africa, and South America. Many of those skulls show something remarkable. Smooth, rounded bone, growing back around the edge of the hole. That smooth bone is proof that the person did not die from the operation. Their body kept living long enough to heal. In parts of ancient Peru, researchers studying trepan skulls found that survival rates actually improved over the centuries, as healers refined their technique, eventually reaching what some studies estimate was success in the majority of cases. People were surviving open skull surgery, done with stone tools, in the Stone Age. They were not doing it with nothing at all to help them either. Ancient healers reached for whatever numbed the senses even a little. In Sumer, one of the earliest civilizations on record, physicians grew the opium poppy and called it the joy plant, using its extract to dull pain and calm the mind before a procedure. Other cultures used fermented alcohol, chewed coca leaves, or ground up mandrake root, a plant known to cause drowsiness and confusion in large doses. None of these came close to making a person unconscious. What they did was buy a little distance from the pain, just enough to get the patient through the worst of it without fighting quite as hard. The written record backs this up too. Around 1600 BC, an unknown Egyptian physician wrote what we now call the Edwin Smith Papyrus, a scroll describing 48 real medical cases. It reads almost like a modern case file. For each injury, the physician records the examination, the treatment, and the likely outcome, including several cases he labels honestly as beyond help. This document proves that ancient physicians were not just guessing. They were observing, recording, and learning from real patients, the same way doctors do today. Centuries later, in ancient India, a physician known as Sushruta compiled an enormous body of surgical knowledge into a text called the Sushruta Samhita. It describes more than 100 different surgical instruments and over 300 procedures, including an early form of reconstructive surgery, where skin from a patient's cheek or forehead was used to rebuild a damaged nose. This was often performed on people who had been disfigured as punishment, giving them back a face they could live with in public. It is considered one of the earliest examples of plastic surgery in the historical record, done long before anyone understood how to stop a patient from feeling it. Roman military surgeons took a more brutal, practical approach, because they were operating on soldiers pulled straight off a battlefield. Their biggest problem was not pain, it was bleeding. A soldier could survive a wound, but not survive bleeding out from it. So Roman surgeons became skilled at closing wounds fast, using cauterization, pressing heated metal against torn flesh to seal the blood vessels shut. It was agonizing, but it worked, and speed mattered more than mercy. They also cleaned wounds with vinegar and wine, without knowing why it helped. It simply seemed to make wounds heal cleaner more often, and generations of surgeons who came after them kept doing it, purely because it worked. Some ancient cultures solved the same problem, closing a wound, in a way that sounds almost unbelievable today. In parts of Africa, India, and South America, healers used soldier ants with unusually strong jaws as a kind of living stitch. They would pinch the edges of a wound together, then hold a live ant against the cut and let it bite down across the gap. The ant's jaws would lock shut and hold the skin in place. Once it had bitten, the healer would snap the ant's body off, leaving just the head and jaws behind, clamped onto the wound like a tiny staple. A single wound might need a whole row of them, lined up one after another, holding a person together with insect jaws until the skin underneath had time to heal on its own. Later, in medieval Europe and the Islamic world, physicians developed something called the sleep sponge. A natural sponge was soaked in a mixture of opium, mandrake, and other sedative plants, then dried. Before a procedure, the sponge was soaked again in warm water and held under the patient's nose, and the fumes were meant to bring on drowsiness, or a kind of half-sleep. It was the closest thing to anesthesia the world had for hundreds of years. But the mixture was inconsistent. The dose was impossible to control, and too strong a batch could kill the patient before the surgeon ever picked up a blade. So even this early attempt at painless surgery was itself a gamble. And here is the twist that made all of this so much crueler than it needed to be. Surviving the cutting was only the first challenge. Nobody in the ancient or medieval world understood that invisible organisms caused infection. A wound could be closed perfectly, the bleeding stopped, the patient conscious and talking, and still, days later, a fever would set in and slowly take the patient's life anyway. Some old remedies accidentally helped. Honey, often packed directly onto wounds, has natural properties that fight bacteria, and healers who used it sometimes saw better outcomes without ever knowing why. Moldy bread was pressed onto injuries in several ancient cultures, centuries before anyone connected mold to the antibiotics we use today. But these were lucky guesses, repeated because they seemed to work, not because anyone understood the actual cause of infection. For every remedy that helped by accident, there were just as many that did nothing at all, and the patient's fate came down to luck as much as skill. A historian once compared the odds of ancient surgery to walking onto a battlefield. Choosing to have a wound treated, or a growth removed, or a bone reset, meant accepting a real chance you might not survive the days that followed, even if the operation itself went well. That was the deal ancient people made every single time they agreed to be cut open. Endure the procedure fully awake, with whatever herbs or wine were on hand to dull the edges of it, and then hope your body could fight off an invisible enemy that no one on earth yet understood. Think about what that meant in practice. A farmer who broke his leg in a fall might survive the bone being set, only to lose his life 2 weeks later to a fever nobody could explain. A mother who survived childbirth might still die days afterward from an infection that started with unwashed hands. Ancient physicians were not careless. Many of them were careful, thoughtful, and skilled with the tools they had. They simply could not see the thing that was actually killing their patients, because it was too small for the human eye, and it would stay invisible for thousands more years. Some of this knowledge was lost along the way. When the Roman Empire collapsed, much of its surgical expertise faded out of use in parts of Europe for centuries. It survived instead in the Islamic world, where physicians such as al-Zahrawi, working in the 10th century, wrote extensive medical texts describing surgical tools and techniques, including new ways to tie off blood vessels instead of relying only on cauterization. His work eventually made its way back into European medicine, but only after a long gap where knowledge that could have saved lives simply was not being used. This was the state of surgery for thousands of years. Awake patients held down by helpers, working through pain with stone tools, sharpened metal, wine, opium, and honey, hoping the body would win its own private war against infection afterward. And then, in one single decade, almost the entire ordeal ended. October 16, 1846, Massachusetts General Hospital, Boston. A patient named Edward Gilbert Abbott is brought into the operating theater with a tumor in his neck. The room is full of medical students, there to watch a surgery the same as they always had. The surgeon is John Collins Warren, a man who has spent decades cutting into fully conscious patients. A dentist named William Morton arrives, carrying a glass device filled with ether vapor, an idea most of the room does not expect to work. Morton has Abbott breathe from the device until he goes still. Warren makes the first cut, and for the first time in that room's entire history, there is no scream, just quiet breathing while a surgeon works. When Abbott wakes up, he says he felt almost nothing at all. Warren turns to the crowd of students and says, "Gentlemen, this is no humbug." Word of it spread across the world within weeks. Surgeons everywhere, in cities that had spent thousands of years cutting people open while they were fully awake, began using ether almost overnight. It replaced the poppy extract, the wine, the mandrake root, and the sleep sponge in a matter of months. Tools that had barely changed in thousands of years, suddenly made obsolete by a glass jar of vapor. Not everyone welcomed it right away. Some doctors argued that pain was a necessary part of surviving surgery, believing the body needed the shock of it to stay strong enough to endure the operation. Others insisted that suffering through an operation awake was a test of character, and that sleeping through it was somehow cheating. A few even worried that a sleeping patient in front of a room full of strangers was somehow improper, and that a woman in particular should remain conscious and modest throughout. These were old ideas, the same ones that had convinced ancient people for thousands of years that pain was simply the price of being healed, and that a body pushed to its limit was a body proving its own strength. But the objections did not last. In 1853, Queen Victoria used chloroform, a similar pain-relieving gas, while giving birth to her 8th child. Once the most powerful woman in the world had chosen a painless option for herself, in front of the entire British public, the argument against it collapsed almost overnight. Doctors who had spent years insisting pain was necessary suddenly had nothing left to stand on. The other ancient killer held on a little longer. Infection kept emptying hospital wards well into the 1860s, until a surgeon named Joseph Lister began treating wounds and instruments with carbolic acid, based on the growing understanding that germs, not bad air or fate, were causing the infections that had haunted surgery since the very first trepanation thousands of years earlier. Once doctors accepted that invisible organisms were the real enemy, the second half of the ancient problem finally began to fade too. Tonight, somewhere in the world, a person will be wheeled into an operating room, put to sleep in seconds, and cut open without feeling a single moment of it. A machine will track their heartbeat. A team in clean gloves will work in a sterile room, and every instrument touching their body will have been washed and sealed specifically to keep invisible organisms out. Tomorrow they will wake up sore, ask for a painkiller, and go home within a few days, already planning what to eat for dinner. The man from that Stone Age village, scraped open with a piece of flint while his neighbors held his arms down, would have called that a miracle beyond imagining. The Egyptian physician recording his 48 cases on a scroll, and the ancient Indian surgeon rebuilding a stranger's nose with skin from his own forehead would have given almost anything to trade places with the patients of today. So would the soldier who once had ants clamped along a wound to hold him together, and the villager who lay under a sponge soaked in mandrake and opium, hoping the dose was strong enough to dull the pain, and not strong enough to kill him instead. For thousands of years, surviving surgery meant surviving on courage, luck, and whatever plant, drink, or insect was on hand to dull the worst of it. It meant hoping your body would win a war against an enemy nobody could see or name. Then, on one ordinary October morning in Boston, all of it changed at once, and the price of being healed dropped from unbearable to almost nothing. It has stayed there ever since. Every single time you or anyone else has gone under the knife without a memory of what happened in between, carrying no idea at all just how much it once cost the people who came before you.